Let's talk about some things that I would not ignore in my ICU patients and that would make me suspicious that they are about to tank or decompensate. One is an increase in heart rate. Now, increase in heart rate could be from a lot of different things: dehydration, fever, pain, anxiety. But if all of those things are ruled out and my heart rate's increasing, I'm gonna be suspicious that something else is going on. Following that, any arrhythmias make me suspicious. So if they start to go into AFib or start to throw a bunch of PACs or PVCs, I'm gonna be suspicious and I'm gonna be checking their labs and seeing if I can find any reason why they may be throwing these different arrhythmias. Next is a drop in blood pressure. Anytime I have a drop in blood pressure, even if it's just kind of a little drop, but I'm continuously going up on my vasopressors, that's concerning to me. Next is an increase in oxygen demand. Yeah, that's what it's like having kids. Anytime I have a patient that's on a couple liters and all of a sudden they're on like high flow, vapotherm, they have to go to BiPAP, I'm gonna be concerned and maybe looking for why they're having an increase in oxygen demand. Next is a drop in urine output. A drop in urine output tells me that the kidneys are not too happy. Maybe they need better perfusion, better blood pressure. Maybe the patient's dehydrated. Maybe they have an infection that's affecting their kidneys. But anytime my urine output's less than 0.5 mils per kg per hour, I'm definitely notifying the provider. Next is an increase in lactic acid. If I notice my lactic acid is trending up, even despite interventions, I'm very concerned that there's some sort of raging infection, that there's some sort of metabolic demand like ischemia or something going on that's increasing the patient's lactic acid. Next is a change in mental status. Either the patient starts to become more restless or irritable, more confused, and even more concerning is when they start to become more lethargic and sleepy and difficult to arouse. The last one is any significant change in labs, but specifically a drop in hemoglobin. If I notice my patient's hemoglobin was 10 yesterday and this morning it's 7, I'm going to be concerned. I'm going to be looking into reasons why they may be bleeding, or have we given them a ton of fluids, but what is going on that has caused this sudden drop in hemoglobin? Those are just some of the things that kind of raise my, little red flags, my little nursing suspicions, and I definitely want to look into those things. If any of them arise, let me know if you can add anything to this list.